So Botox is botulinum toxin, and how it works is every muscle has a nerve that sends a signal for that muscle to kind of fire and contract and be activated. And Botox works in that space where the nerve and the muscle are interacting, and it prevents the nerve from sending that signal to fire that muscle. And what it does is it relaxes that muscle and prevents those fine lines and wrinkles over time. So the process of Botox is not complicated if you go to a trained professional. For me personally, I like to evaluate the patient one-on-one, face-to-face. We go over troublesome areas, fine lines, fine wrinkles that might be bothering the patient. I show them the mirror, I have them activate their muscles, and whatever areas are bothering them, talk about them one by one, and we attack those one by one. So when the muscles are activated, what they do is they contract. And so these are muscles of facial expression that we use every day. And over time, when you kind of over-animate your face, it can create little fine lines and wrinkles in the skin. And Botox, what it does is it relaxes those muscles to prevent those fine lines and wrinkles from forming. Anytime you have a facial expression, whether you're smiling or frowning, these are kind of common, normal facial expressions. The muscle of the facial expressions, they contract. And what they do is they can kind of tug on the skin, and over time they create little fine lines and wrinkles. And Botox targets these little muscles to prevent them from contracting, allowing them to relax, and prevent those little fine lines and wrinkles from forming on the skin. When I see a patient for Botox evaluation, the way it works in my hands is I see the patient one-on-one, face-to-face consultation. I usually like to have a mirror so we can look at their entire face, top to bottom. Then I like to ask them, to animate their face and tell me what little fine lines, areas, or wrinkles typically bother them. And then I offer them my best suggestion of how to treat those areas. After we agree on what areas to target, typically I'll clean your face with alcohol, just to let that dry, make sure we're all clean. I use a very small syringe and a very small needle loaded up with a certain number of Botox units for each specific muscle. And then we go through the injections one by one. If there's at any point, the patient feels uncomfortable, I stop, we talk through the process again. But typically they tolerate the procedure very, very well. So one of the most common questions that I'll get from patients prior to Botox injections is, does it hurt? As long as you have a trained professional who's done these injections before, it really does not hurt. I use a very tiny needle with a very small syringe, and I do these injections, very carefully and meticulously, so it does not hurt. One of the other most common questions I'll get is, when can I exercise? When can I shower? Can I use my makeup if I want? And typically for all of those, I say give it about 24 hours. After 24 hours, you should be able to wear makeup like you normally do, as long as there's no really aggressive chemicals in your makeup. You can shower with kind of lukewarm water as you normally do. You can exercise 24 hours later and do, anything that you normally is part of your routine without any restrictions. So if you get Botox just in your forehead, typically one of the most common areas that we look at as injectors is the eyebrow. So you have opposing muscles. It's kind of like a tug of war. You have muscles that pull your eyebrow down, and you have muscles that lift your eyebrow. The forehead muscle lifts your eyebrow. So if you're only getting forehead Botox injections and you're relaxing that muscle that lifts your eyebrow, the muscles that drop your eyebrow will always win. And so over time, you can have a very low eyebrow, which is not aesthetically pleasing. That's why it's important to go to a trained injector, because it's very rare that you would just treat the muscle that lifts the eyebrow, because we know that it's going to lower their eyebrow position, which is not a great result. So one of the most important things to consider is the position of the eyebrow, prior to injections of Botox. A trained aesthetic professional who knows, which muscles are acting on the eyebrow in which way knows how to treat certain areas. So just injecting Botox simply just in the forehead or injecting it too low into the muscle of the forehead, what that's going to do is it's going to allow the muscles that lower the eyebrow kind of win in the tug of war. You're going to have a low eyebrow position, which is not youthful or not aesthetically pleasing. So it's really important to kind of go to a professional who knows, which muscles anatomically are pulling the eyebrow in which direction. Sometimes, we have patients who come in and, they were recommended, or they just say they want, only forehead Botox. And I like to talk through the process with them and explain which muscles are pulling in which direction. I like to show them their eyebrow position. And sometimes just treating one muscle that simply lifts the eyebrow, I warn them that it's not the best idea, because the muscles that kind of drop the eyebrow are going to win, and they're going to have a very low set eyebrow, which I think they're not going to be happy with. It's not an aesthetically pleasing result. Botox is not simply just about fine lines and wrinkles. You have to know facial anatomy. You have to know, which facial muscles are pulling your face in which way. The goal there is to treat the entire face so it's harmonious and aesthetically pleasing. So Botox can change your face by acting on specific targeted muscles of facial expression. And that's why it's really important to go to somebody who knows the anatomy of the facial muscles and knows which muscles to target with a specific targeted number of Botox units. Common areas that are treated are the forehead muscles, the glabella region, which is kind of like in between your eyebrows, and these crow's feet, which are your orbicularis oculi muscle. These are really probably the three most common areas that I treat in my practice with Botox. And it's important to know which muscles are pulling in which direction, because it can give you, the ideal optimal aesthetic result. Treating specific areas of the face with Botox can potentially alter certain anatomic areas of the face. So one example is the eyebrow. The eyebrow has multiple muscles that act on the eyebrow. Some elevate the eyebrow and some lower the eyebrow, and these are normal. So if you just treat a muscle, for example, that elevates the eyebrow, and you allow the muscles that lower the eyebrow take over, what you'll have after Botox is not an ideal result, because you'll have a low eyebrow position, which is associated with aging, and it's just not as aesthetically pleasing. The best way to get an ideal Botox result is to see somebody who's trained in Botox injections, who understands facial analysis top to bottom, who understands facial anatomy and musculature and how each muscle works on the face. It's really important to see a trained professional for your Botox injections. In my experience, plastic surgeons who have completed a plastic surgery training program, we get trained in not only Botox and fillers and other things, we get a very deep training of facial anatomy. So then when we do learn how to perform Botox injections or any other injections, we know exactly which muscles we're treating, why we're treating them, because of our understanding of facial anatomy is thorough. Any trained medical provider can perform Botox injections. It's up to the patient to, seek out who they're most comfortable with. Somebody who understands facial anatomy and facial analysis is probably the ideal person to perform any facial procedure, whether that's surgical or non-surgical like Botox. But ultimately, it's up to the patient to seek out, a trained provider who knows exactly what they're doing. Every practice sets their price differently. Some people charge per unit. Some people charge per anatomic area they're injecting, which then they choose a certain number of units to weaken or relax that muscle. Some practices are, you're right, per unit. Some say forehead is this much, this area is this much, this area is that much. So the price of Botox typically will vary, on each specific practice, depending on what area the practice is in, depending on the expertise of the provider who's injecting the Botox. Some people will price Botox per unit. Other practices will price Botox per anatomic region of the face that's being injected. I don't think either one is right or wrong. It's just specific to each practice. The person who is providing the injections, you're also, in a way, paying for their expertise and their knowledge of facial anatomy and what muscles they're targeting and why, rather than just simply injecting a product. Because in reality, the price range can be as cheap as $10 a unit. Could be as expensive as $23 a unit. For example, in our practice, what we do is we charge a certain rate for Botox, but with that rate comes a follow-up. We don't just inject Botox and say, kind of see you later. I always want to see you back. I want to evaluate, did the product work? Do I need to add Botox in a certain area? And when I do need to add Botox in a certain area, that's free of charge. Because a lot of practices you will actually go to and they'll inject Botox and there really isn't any follow-up. So follow-up after receiving Botox injections, typically I'll see patients 2 weeks after I inject them. It's really important to me because I have photographs before I perform the injections to see which little fine lines and wrinkles or muscles that I'm actually targeting. And then I see them back after 2 weeks just to analyze my result. am I happy with it? Is the patient happy? Or is it an area that I feel like I injected the correct number of units, but maybe that muscle is just a little thicker, a little stronger, and needed just a touch more of product. So I'll always do that. So the factors that determine the price of Botox there's a couple. So one is how many units are being injected. Two is, what area of the face, which muscles are being targeted, the region in the country, the practice that you're going to, who is selling and performing these Botox injections. And then just the expertise of the provider to perform a true facial analysis, to perform a follow-up with the patient, see did the product work, did the product not work as much as they would have liked it to, because I think follow-up is very important for patient satisfaction. Patients need to go to trained providers and somebody who they feel comfortable with. Money is always going to matter. Sometimes you can afford one provider and you may not be able to afford another practice's provider. The ideal situation would be kind of having those two gel together for the patient, where it's a price that they feel comfortable with and a provider that they feel comfortable with. I wouldn't go with one of those two being kind of a positive and the other being a negative. Those two have to be synchronous together. One of the most common questions that I'll get from patients is, how long will this Botox product last? And typically what I tell them is, everybody's a little different with how they metabolize Botox, but generally Botox is lasting about anywhere between 3 to 6 months. Some will say 3 to 4 months. 3 to 6 months is a pretty safe answer, and everybody again is different. Some will metabolize it a little quicker than others. Factors that affect how long Botox lasts for, there's really not many that will alter the lasting of the product. I tell patients you can exercise. Whether somebody who exercises every day metabolizes Botox quicker than the person who's not. So generally, there's really anything that you would do in your daily life that's going to rapidly metabolize the product. I don't think that adding extra units of Botox is a good idea by any means. There's a certain number of units that we specifically draw up to target very specific small muscles in the face. Nobody should be doubling up on the units to get a desired effect. It's just not recommended. It's not FDA approved. In fact, I think you could really weaken the muscle and get suboptimal results. Botox typically takes about, I would say, anywhere between 5 and 7 days to get a full effect. One of the most common scenarios that I'll get is, patients come to me because they have an event and they say, I just want to get some Botox treatment prior to this event. When should I do it? I don't think getting Botox injections the day before or the day of the event are ideal, because it takes about 5 to 7 days to see the full effect. So I'll tell them, just come about 1 to 2 weeks before your event, your outing, because that's when you'll get your kind of most desired effect. Factors that can influence the effect of Botox, one of the most important ones is the amount of units used for a specific muscle. If you use an incorrect number of units for a muscle, you're not going to get a desired effect. But if you go to a trained professional who knows exactly how many units to use for a specific targeted muscle, you're going to get your most optimal desired effect. Botox typically will last the patient 3 to 6 months. And what I tell them is, when you look in the mirror and you start to see those fine lines or wrinkles again, because the muscle is now activating again, and if they bother you, then you can always come back for another round of injections. But it's not something that's medically required or necessary. It's just a product that typically will last about 3 to 6 months. Personally, I wouldn't recommend Botox injections as long as there's still product that is active and working. So if a patient comes back to me, say 6 weeks after her Botox injections, and she had a great result or he had a great result, they tell me, I just like to kind of double down and get Botox again. In my practice, that's not something that I do, because I follow these patients over the course of time. I don't just do one injection session and say kind of goodbye. I follow them over the course of time. I like to see how many units did I use last time, what was my follow-up result, and then I kind of customize the units for their next session. I like to kind of follow the chart and say, I did it at this time, this is how many units I used for this area of the face, this was my result, it looks like it's wearing off now, so I know exactly how to kind of customize the product again. I don't just kind of randomly pick a number and just inject it into the face. When I see them, I like to think, how much did they have, how long ago was it, what was the result? So then when I see them again, in my mind, I know, okay, it's wearing off this many units. This is how many units worked. I don't need to go less. I don't need to go more. It's kind of very individually based. It's really like a customized treatment. How often a patient should get Botox really is up to, again, the individual patient. The product, like I said before, will last 3 to 6 months. Generally, what I tell patients is when you look in the mirror and you see fine lines or wrinkles that are kind of coming back, or when you're activating your face, if they bother you, then that's when you should come back and just get another round of treatment. If the frequency of Botox appointments isn't ideal, if it's too short, for example, if the interval of time is too short and you still have product, then you're putting too much product into a specific muscle. The effects of Botox can last longer. It can potentially give you a suboptimal result by really weakening a muscle a lot more than was intended. And on the other side, if the intervals are kind of too long in between, there's really no bad result because, again, you don't need Botox. It's something that you desire. Nothing really bad can happen. What will happen is just those fine lines or wrinkles that bother you will just return. Botox is a very safe product to use as long as you go to a trained provider who has experience injecting the product. As long as you know how many units for which specific muscle required to get the optimal result, it's a very safe product. Botox is generally a very safe product to use, but there are some contraindications and specific group of patients that should not be getting Botox. One is if you have an active infection. I don't recommend getting Botox injections. If you have any neuromuscular diseases like ALS or myasthenia gravis or any other neuromuscular diseases, it's not recommended to get Botox injections because it'll then weaken that muscle even more potentially. Pregnancy, it's not safe to get Botox in pregnancy. And if you have an allergy to Botox, then you should not be getting Botox. Patients who are also contraindicated to get Botox for, if you're on any specific antibiotics, one group is the aminoglycosides. A group of patients that Botox is not typically recommended for is patients that are on a certain class of antibiotics that are called aminoglycosides. And the reason is the aminoglycosides can potentiate the effect of Botox. What that means is it can actually make the effect a little stronger than it's intended. There's always a risk that you can have kind of asymmetric, uneven results, where the provider is really just kind of guessing. It's not recommended to inject Botox in those patients. Botox generally is a very safe product as long as it's administered by a trained professional who has experience with using Botox. The reason Botox is very safe to use is because, one, it's not a permanent product, so it will eventually wear off, which is one of the good things about it, because if there is an asymmetric result or there is a suboptimal result, after a few months the product will wear off. It's not a permanent change to the face. What I tell my patients after Botox injections, as far as sleeping patterns, I say, the first 24 hours, sleep on your back, you don't put any pressure on your face, and typically just put like 2 pillows kind of under your head so you have a little bit of a head elevation. But it's really important not to sleep on your face immediately after Botox injections to prevent any product migration in your face. If you do sleep on your face immediately after getting Botox injections, what can happen is the product, which is specifically targeted for a specific muscle, it can migrate to a different muscle that was not supposed to be targeted. And if that does happen, it'll weaken the muscle that was not supposed to be targeted, and it can give you a really asymmetric, suboptimal result. If you don't sleep properly after getting Botox, one of the risks is that the Botox product that is specifically targeted for one specific muscle can kind of travel and migrate to a different muscle and weaken that muscle as well. And what that'll get you is a result that was not desired and potentially asymmetric. The other thing is sleeping on your back with, I tell patients 2 pillows, behind their head just for some slight head elevation. Sometimes patients ask me, can I sleep on my side? And I tell them, I still recommend just sleeping on your back, because if you could imagine sleeping on your side, gravity will still potentially have that product migrate over to a muscle it wasn't intended for. Botox really won't affect your sleep pattern at all. It shouldn't make you sleep more or sleep less. It's really about positioning of sleep, and it's just generally recommended the first 24 hours to sleep on your back. I tell patients that they are able to wash their face after Botox injections, and just what I recommend to them is lukewarm water, just like you normally would wash your face, but definitely no rubbing or scrubbing of the face. I kind of tell them just take a towel and pat your face dry. And the reason I tell them that is if you kind of rub or scrub your face after Botox injections immediately after, you can kind of move that product around, which we don't want happening. Immediately after Botox injections, I tell patients for the next 6 to 8 hours just kind of keep your chin up, leveled up. You know, I don't want you kind of looking down, chin down, because there's always a risk that the product can kind of migrate with gravity, and we just don't want that product moving around. So for 6 to 8 hours, I just tell patients kind of, you know, keep your head level up. So after Botox injections, you can use your normal kind of everyday skincare routine products. So what does that mean? Water with soap, not a problem. Sunscreen should be fine after 24 hours. Moisturizer should be fine after 24 hours. The things that are kind of not recommended to use are exfoliants on your skin after Botox injections, as well as any harsh chemical kind of makeup. But after 24 hours, regular makeup routine should be fine. Washing your face after Botox injections doesn't matter the frequency, whether you should do it less or more. I always tell patients after 24 hours, just do what you normally do with your skincare routine. Whether that means washing your face a couple times a day, once a day, whatever you do, you can do it. It's not a problem. After the first 24 hours, you can go right back to your, everyday makeup routine. Despite even Botox injections, you really should avoid harsh chemicals in your makeup because it can damage your skin or your face. Theoretically, also, you have a puncture site on your skin, right? So now you're gonna put a chemical there. It's not gonna go anywhere, but theoretically, you now have a channel for the makeup to travel through. Does that matter? Probably not, to be honest with you. But it's a very general recommendation. 24 hours, kind of leave your face alone. It's like if you get your blood drawn, right? And somebody sticks a needle in your, in your vein. It's kind of very similar to Botox. People ask like, oh, can I put cream? No, just leave it alone. You have an entry point. Generally, I tell patients after Botox injections to avoid makeup for 24 hours. And the reason is when you're applying makeup, you tend to rub your face, massage your face. In my mind, that product is just under your skin. So I really don't want you moving that product around because what can happen is it can potentially affect a muscle that I was not intending to treat, and it can give you asymmetric results that are just not optimal. So Botox can be injected into multiple different areas on the face, targeting specific muscles. Some of the most common areas that I treat are the frontalis muscle, which is the forehead, the glabellar region, where we treat the procerus muscle, that's kind of like right on the bridge of the nose, and the corrugator muscles, which are very small muscles that kind of bring your eyebrow down. And what that creates most commonly is the 11 lines that patients complain about. The other area that's really common to treat is kind of right on the side of the eye, and that's where most patients complain of crow's feet, these little kind of wrinkles and fine lines. I would say those are probably the three most common areas that I inject Botox. So Botox can be injected into multiple different areas on the face, targeting specific muscles. Some of the most common areas that I treat are the frontalis muscle, which is the forehead, the glabellar region, where we treat the procerus muscle, that's kind of like right on the bridge of the nose, and the corrugator muscles, which are very small muscles that kind of bring your eyebrow down. And what that creates most commonly is the 11 lines that patients complain about. The other area that's really common to treat is kind of right on the side of the eye, and that's where most patients complain of crow's feet, these little kind of wrinkles and fine lines. I would say those are probably the three most common areas that I inject Botox. The 11 lines that are kind of commonly termed, patients come in and when they kind of frown, they have two wrinkles or fine lines in between their eyebrows. And what that is there's a muscle on each side named the corrugator, and when that muscle is kind of activated, it gives you these kind of two fine lines. So by targeting those muscles to relax, we get rid of those fine lines when patients are frowning or making facial expressions. So the most common injection points in my practice are the forehead, which is the frontalis muscle, the glabellar region, which is in between the eyebrows, and that includes the procerus muscle and the corrugator muscle. And then the third area is kind of on the side of the eyes, that when you smile, you have these little fine lines that people commonly refer to as crow's feet. That's another very common area that I treat with Botox. The procedure of injecting Botox is not exactly the same for each specific area of the face, because each muscle requires a specific number of units to relax that muscle. So it's really important to go to somebody who knows exactly how many units they want to use for each specific muscle to get the ideal aesthetic result. A very common question that I get from patients after Botox injection is if and when they can exercise. And what I tell patients is they can exercise, they could do their normal routine 24 hours after Botox injections. There's no specific exercise routine or type of exercise that you need to avoid after Botox injections. As long as patients wait 24 hours after injections, they can go right back to their normal routine, whether that's running, cardiovascular exercise, yoga, Pilates, weightlifting, whatever it may be, as long as they wait 24 hours. Overall, patients after Botox injections, they can go right back to their exercise routine as long as they wait 24 hours after their Botox injections. And the reason I recommend patients wait 24 hours is because we really don't want you sweating and activating those muscles immediately afterwards, because that product that we inject could then potentially migrate to another muscle and give you not an ideal result. Generally, I just tell patients you can act the way you want to act after Botox. You don't need to not smile, or if you want to frown or whatever it may be. I wouldn't say don't do that. It's kind of natural to do that. What I tell them is 6 to 8 hours, just kind of relax. Try your best to just relax, maintain kind of a neutral kind of facial expression. Really important thing to keep your chin up. Just don't put any pressure on your face, whether that's laying on a pillow or even massaging your face.